Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Erica Prochaska, thanks so much for joining me.
Thank you for having me. It's great to be back.
So today, of course, I want to talk about the flu. We're seeing lots of hospitalizations, lots of cases. People are dying. So why is it so bad right now?
So excellent question. I think that in terms of how it's so bad, there's a couple different measures of how bad it is. And you mentioned several of them, right? One is the just sheer number of people who have influenza. And this is the highest peak, according to the Centers for Disease Control and Prevention, since about 2015, 2016. So it's definitely the most numbers we've seen in about a decade. And in terms of severity of infections, we are seeing, unfortunately, a lot of very sick patients. The past week that the Centers for Disease Control and Prevention reported this data, which was the end of February 8th, it was about a 2.6% of deaths in the United States were believed to be due to influenza, which is the first year that since the COVID-19 pandemic that influenza has surpassed COVID-19. So it certainly is a very brutal flu season. And we're seeing that in the clinics, in the emergency departments. I know my colleagues in emergency medicine are seeing a ton of patients with influenza. And unfortunately, we are seeing a lot of patients hospitalized after influenza. And I'm a pediatrician. We've seen a large number of children who have recently had influenza or currently have influenza who are quite sick.
Are you surprised by what you're seeing?
Unfortunately, in epidemiology, we know that viruses come in waves. And we know that some flu seasons are worse than others. So what's surprising is the timing rate. It's very hard to predict when there's going to be a bad flu season, but we know that bad flu seasons come. When I interviewed for my pediatrics residency less than a decade ago, we were actually kind of in the middle of what would become a bad flu season. I didn't know that yet. So when I got asked at the residency that I ended up matching into for my pediatrics training, the interviewer asked me, what do you think the next crisis in pediatrics will be? And I said, I think that we are going to see a very bad flu year, and that influenza vaccination rates are not very high. And, that is going to be one of the next crises in pediatrics that we see. I was right in that was happening literally a couple months later, 2015 to 2016 season. So I think that just helps kind of give an idea of we have a lot of anxiety in medicine and in infectious diseases and in epidemiology that there could be a bad flu season. It is hard to predict when. A lot of times the global north or north hemisphere uses what's happening in the global south or southern hemisphere as a proxy, but it's very hard to estimate necessarily what exactly will happen.
So are we seeing flu A or flu B? I don't know which is more severe.
Yeah, it's hard to say, which one is more severe because, they do sort of change over time, and it depends on a number of different factors such as, vaccine match and things like that. Right now, it's mostly influenza A. And, I think, honestly, these viruses like to read our textbooks and then laugh at us because I feel like we'll say something like, oh, well, this is typically more common with influenza B. And then we see a ton of patients with influenza A that have it. So, I hate to draw broad strokes about or brush broad strokes about which influenza is worse. Influenza is influenza, and it can be very severe. Right now, it's a ton of influenza A. We haven't actually seen that much influenza B yet, which again does make me nervous. I don't think it's because it's not circulating. It makes me think that we might have another peak in a little bit later in the winter, maybe in the early spring with more influenza B. But again, that's sort of based on what's happened in prior years. We often sort of see them cluster together. Maybe we'll be lucky this year and we won't see that much influenza B, but I'm a little concerned that we might see those numbers start going up.
So I know a big deal in flu seasons can be if the vaccine matches the strains that are circulating. So I'm curious, does that vaccine work this year? Does it match this year?
To the best of my understanding, and the caveat is that I'm not a vaccine researcher, but based on the strains that are circulating and the strains that are covered in the vaccine, yes, it should match. The current vaccine that's distributed in the United States covers 3 types of flu, 2 types of influenza A, and 1 type of influenza B. And to the best of my understanding, there should be match with what's circulating right now. However, only about 45% of people in the United States are vaccinated. That's a rough estimate looking at the percentage of children, adults, people who are pregnant. When I look at those numbers, it's roughly 45%. So the vaccination coverage is not optimal. Additionally, the influenza vaccine is not 100% effective at preventing people from getting influenza. I think you get your most bang from your buck in preventing really bad complications from influenza with the vaccine. So when we look at the numbers of influenza that we're seeing, it's sometimes hard to gauge how ill people are. Even when we look at hospitalizations, which I think is the best measure of illness, it's hard to know how many people are in the hospital because they have influenza A or they tested positive for influenza A and they're there for something else. So I would definitely say it's a more severe year, and that, vaccination coverage isn't terribly high, but it's actually not that different from prior years when I went back and looked at the numbers. So I think it's probably a combination of a lot of circulation this time of year. Maybe people are feeling a lot more comfortable going about their normal activities, even as compared to last year. After the COVID-19 pandemic, vaccination uptake wasn't terribly high. And there may be something that we don't quite understand about these viruses, or I don't understand yet. Maybe there's people in the lab who have an early understanding and are going to publish something really interesting soon. But when I did a brief literature review, I couldn't find any data suggesting why this year it's spreading more or is more severe, but maybe we'll have a better understanding of that soon.
I wanted to ask, I know that some schools have been closed, like it's been pretty serious in certain places, and you're saying, the ERs are full of people with the flu. And we did quote some CDC numbers. There has been sort of a bit of a hiccup in the data, and I'm wondering if that's hurting our response at all.
It's an interesting question. I think that the CDC numbers are really helpful for communicating the scale, but I think that people generally know there's a ton of flu right now. So I think that the awareness is out there, and I think that the media, to your point about having this very podcast, right? You look at the New York Times, NBC, NPR, pretty much every major outlet is covering something about the flu. And I think really the most important thing right now is getting people to understand that there's flu circulating, understanding that if they have flu-like symptoms and they're high risk for severe flu, they need to call their doctor, see if they can get tested, see if they're a candidate and should start on a medication called Tamiflu that can make flu less severe, especially for those who are at higher risk for complications. And that people should be careful, right? You don't share drinks, wash hands, try to avoid being around people who are vulnerable to severe flu if you're sick, that type of thing. So I think that there is a lot of information out there for people to help us try to combat this. And I also would advocate that it's not too late to get a vaccination either. And I am hoping that some of the information that's out there is encouraging people to do that. Because again, I mentioned we haven't seen a ton of influenza B, and there is influenza B in the vaccine. So if we do see an uptick in influenza B in a couple weeks, and it takes 2 weeks for your immune system to respond to the vaccine, now could still be a very good time to get a vaccine to prevent severe influenza later.
People call lots of things the flu. So just a quick reminder for what are the symptoms?
Yeah, I think that one of the biggest issues with combating the flu is not so much lag in data, although I love data. I'm an epidemiologist, but I do think that it is, for most people, the fact that we call everything the flu. Because, it is completely medicine's fault, right? There's the stomach flu, which is more of a lay medicine term, right, that people use. I've used, my husband has used, right, when our kids are sick. It's not typically usually the flu. Probably that's norovirus, which, was ripping through the United States and still is, although it seems maybe it's calmed down a little bit. People call that the stomach flu, right, which is miserable. But it's not influenza. Influenza is a virus that typically causes a sore throat, runny nose, cough, high fevers, muscle pain. Those are like the main things. Sometimes vomiting and diarrhea. But less so. I would say that most people who have flu just feel absolutely miserable. You feel exhausted, your muscles really, really hurt. The cough can be pretty severe. And one of the most dangerous things about influenza is not actually the virus itself, it's that the inflammation from the virus and the sort of brief weakening of the immune system after the virus make people more susceptible to pretty serious bacterial infections afterwards. So, that's how it's very different from a lot of the other viruses that circulate this time of year, which may cause a runny nose, a cough, maybe a mild fever, but don't necessarily leave people feeling just completely wiped out, sometimes for weeks. So that's the main way I differentiate it. But we've named so many things influenza in medicine. I mean, we've named bacteria influenza, Haemophilus influenza. We have a virus called para-influenza. It's incredibly confusing for patients. We really needed to think ahead of time naming these things and name them slightly differently. But most clinicians, doctors, nurses, can walk into a room in the wintertime, and if they see a patient that has influenza, they almost automatically know it because, that person just looks completely miserable, unfortunately.
Yeah. My husband had it and somehow I escaped. So that's a victory, I think. So also something else we're worried about right now is the bird flu, which is not the same as the circulating flu right now, but it's complicating things. Is that right?
Yeah, it is complicating things. So the bird flu is H5N1 that is circulating largely among poultry, birds, some cows. And we know that that has been transmitted to people. So again, the best of my knowledge, I'm not aware of any human-to-human transmission of the bird flu. The thing that makes us really stressed about new types of flu is that the reason it's hard to create a good vaccine to flu is that flu really likes to hang out with its buddies and learn from each other. And we call it, it sort of can change over time and it learns tricks from other strains of flu. It makes it harder to develop a vaccine. And that also means that when there's a lot of circulating flu and there's also circulating H5N1, you could see a possibility where that bird flu becomes better at infecting people, right? So that's why it's so much at the top of everyone's mind. And it's also, hugely, economically burdensome for farmers, right? There's large numbers of birds and cows that are being quarantined or culled because of this infection. So, it is a very big problem. I don't want to downplay it. It's just, to the best of our knowledge, not currently the majority of the flu now. I know that the Centers for Disease Control and Prevention, had recently recommended testing influenza A for bird flu, and I don't believe that, at least in the state of Maryland, we've had, any human cases of it. So the surveillance is going on in the background, which is great. I think that public health is still very much working on making sure that we identify it as being a threat to humans as early as possible. But I do understand how it also creates a lot of confusion for people because you see one article about there's flu everywhere and then you see about there's flu just in birds. And it's like, okay, but where is it? It's different kinds of flu, right? It's different kinds of flu, but both are concerning.
And are you concerned? I mean, there have been changes in the CDC and the other health agencies. Are you concerned about the surveillance and whether we're learning enough from that we need to know?
At this point, I haven't seen anything that's made me concerned. The FluNet is still up on the Centers for Disease Control and Prevention, and Department of Health data is still being updated. So I do encourage people to also look at your Department of Health websites because departments of health also can track this. And then hospitals also track this as well. I'm an associate hospital epidemiologist in Johns Hopkins Hospital. We can look at our flu numbers. So, at this point, I haven't seen any evidence that has made me concerned. I do think that, when the infrastructure is changed, it does lend itself to future surveillance being impaired, right? So I could definitely see there being issues in the future. As of now, I haven't felt like my job as an infectious diseases physician or my job as an epidemiologist has been impaired by lack of data that I've been able to find.
So one last question, and it's really sort of about the elephant in the room, which of course is COVID. So we haven't had a lot of COVID cases. Is this because there's so much flu, or why do we think that's what's going on?
I think that it's mostly because, viruses kind of peak and go down. And so we could be seeing COVID later in the season. We're sort of waiting to see if COVID-19 develops a seasonal pattern the way that other respiratory viruses do. It went from being a pandemic, right, to being endemic, meaning it's just sort of circulating. And, we can typically expect an increase or a decrease in the numbers. I also think that the home tests may be changing the numbers somewhat. If people who are really sick are sick with influenza, and, maybe people aren't as sick with COVID-19 this year, although certainly people can get very sick with COVID-19 still, it may be skewing our numbers a little bit because now people have access to home tests for both COVID-19 and influenza. So it could be that people are testing themselves for COVID, but they're not sick enough to come into the hospital. And so then that home test doesn't get put into the composite positive test, right? So there might be a little bit of an underestimate. But I definitely wouldn't discount, COVID. I think that we see in epidemiology all the time that one virus sort of seems to be unstoppable, and then all of a sudden it plateaus and goes down, and then there's another virus that comes after it. And that's just how typically the fall to winter, early spring respiratory season goes. And we see that clinically too. 1 week I'll be on service seeing patients in the hospital, and it seems like everyone has RSV, and then I'm off service for a couple weeks, and then it seems like everyone has influenza A, right? So there is a pattern to these things, and I think we have to wait and see what happens.
So we need to wash our hands and wear a mask, perhaps, and unlike me, not share a bedroom with someone who has the flu.
Definitely wear a mask, especially if you are concerned that you're higher risk or you are close to someone who's higher risk for influenza. Washing hands is always a great idea. Hand sanitizer, soap and water. And I also think that it's really important to, get vaccinated if possible to prevent influenza. Now, that might not prevent transmission, but it could prevent severe symptoms. And so I also think that another interesting thing is, like you mentioned, schools getting shut down, daycare is getting shut down. We've just seen a ton of kids with influenza too. And you can't really tell a parent, well, don't take care of your sick kid, right? So, I think within the household, especially when there's young children, it's almost impossible to stop influenza A from spreading around. My youngest son got it a couple weeks ago, and it just went through our entire household. And my husband's takeaway from it was, well, we were trying to be careful not to spread it to each other, and it really dragged everything out. So maybe we should just all try to get sick at the same time next time. I don't agree with that takeaway. I still think it is important to try to not get sick, but it can be very, very challenging.
Erica Prochaska, thanks so much for joining me.
Thank you so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.